is the Arthrokinematic restoration system for the cervical spine. With gravity, the cervical spine can lose its curvature, and therefore the facet joints are not going to be gliding the way that they should or have the mobility. So we want to get the inferior glide and the superior glide back. To do that, we're going to start with the release of the erector spinae or the thoracic paraspinals between the shoulder blade. The ball placement is going to go at the very top of the shoulder blade, right between the shoulder blade. And I'm going to lie down onto the double lacrosse ball, supporting my head and neck with my hands. You want to make sure that the patients are supporting their head and neck. And then slowly rolling right down between the shoulder blades, not rolling on bones, staying on the muscle. It can be very tender, and you want to build up to being able to apply pressure, and this may take some time. So 2 minutes of slow rolling between the shoulder blades to release those erector spinae, the paraspinals, and the thoracic spine. We know in the literature that if you mobilize the thoracic spine with PA mobs, that can help with neck pain. So this is a way for patients to be able to do this on their own. After 2 minutes of releasing those thoracic paraspinals, I'm going to release my scalenes. I've got anterior, middle, and posterior scalenes. They're going to go from the front of the vertebrae in the cervical spine and attach to the first and second rib. And go to your clavicle, go right behind there. You can feel those muscles. Now to release the right side, I'm going to use my left hand and I will just investigate the tension on that area. If I feel a pulse, I'm going to move off of that. You do not want to hang out on the vascular tissue. So I'm going to give a little pressure where I feel any tightness. And then I'm also going to do a stretch with it. So I'm going to release as I stretch. Now I can shorten it and stay off of the stretch and just put pressure. And then I can slowly go into a stretch while I'm applying pressure. And to stretch the scalenes, you're going to look up and away. So I'm doing a combination of both the release and the stretch for the scalenes. And again, for release, it's going to be 2 minutes. So I am just going to spend 2 minutes on one side, and then I'm going to go to the other side and spend 2 minutes going right on that collarbone. I can come and find my anterior scalenes, middle, and then posterior. And you can investigate to find the areas that are most tense or most tender and apply gentle, slow pressure and add a stretch. This is going to help us to reset those muscle spindles and releasing the fascia. So the fascia is more mobile. This allows for a more effective stretch. So we release between the shoulder blades, we release the scalene. Then I'm going to stretch. So I will take a foam roller. You can do this on the edge of the bed, edge of a treatment table. And all I'm going to do is comfortably rest my base of my head right on an end, and I'm going to extend my head. So you want to help the person get into this position. Treatment table works really well for this. I can use the foam roller. If the patient's doing it at home, they can use a foam roller. And you just want to come to the edge of the roller with a nice support, and you're going to hook the base of the skull right at the edge and let the head just hang back. And this is going to allow the back side of the cervical spine to be positionally shortened, and this will help to shut off or reset those Golgi tendon organs that we talked about. So it will help to stretch the front side of the neck too. It just reinforces that stretch from that forward head posture, and it's repositioning and restacking the spine. And it should feel good. If it's painful to be in this position, then you want to come out of this position. And I'll hold this for 90 seconds. So this is going to be just a little bit longer than the 1 minute. So just holding this position 90 seconds. And then the last thing I'm going to do is going to be to strengthen the deep neck flexors. To do that, I will lie on my stomach. And this is because it is difficult to have patients engage their deep cervical neck flexors without really firing the sternocleidomastoid. So I do this on in prone, resting your forehead on a towel roll or on a treatment table, and then just drawing the chin into the chest and holding, keeping the face looking down, holding this for 10 counts, and then relax. I'm going to draw my chin in, hold for 10 counts, and then relax. So I'm going to hold this longer, and I will do 3 sets of 10-second holds and 6 repetitions. And if it's fatigued and earlier than that, then I just stop there and just start with the activation to get the neuro re-education. That is the arthrokinematic restoration system for the cervical spine. When you complete it, it should feel much different to look up, down, and you can even check the rotational component as well in the cervical spine. But the main thing is to improve your inferior and your superior glide. That is the arthrokinematic restoration system for the cervical spine.